My name is Preston, and I used to have type 2 diabetes. Diabetes wasn't something new to me, my parents and uncle had it already too. In fact, I always kind of thought it was genetic, so I expected one day I would inherit it too. When I did get diagnosed, I heard more of the same from my doctor. He told me it was a genetic condition, that it was inevitable and diabetes was just my life now. I was prescribed maintenance medicines and told I could never come off them. This is an all too common story for many people. But I've recovered now, and I'm no longer on any medication. It turns out proper education on diabetes is really lacking, and sometimes even among medical professionals. I wish I had the knowledge back then that I do now. The first step to helping yourself is getting yourself more educated on what the disease is. Sometimes, people see diabetes as if the body is faulty, and it always has been faulty. I think we're too negative all the time. We are always looking around to see what is wrong with us, rather than what is right. Many people like me have found a more holistic perspective on health, more helpful in properly tackling diabetes. We can think of any disease, including diabetes, as functional, rather than faulty. So, we can ask, what function is our diabetes serving? Well, let's understand what is happening to the body during diabetes. The main thing is that our blood sugar levels are too high. It is one thing to eat a sweet meal and see our blood sugar spike temporarily. But in diabetes, we see chronically high blood sugar. When it goes up, it doesn't go down again. Usually, we have a hormone, called insulin, that reduces our blood sugar when it spikes. It sends the sugar in our blood into storage in our cells. But, in people with diabetes, insulin stops being effective. Our bodies become what we call resistant to insulin. That means even though insulin is there, the body doesn't listen to it like it used to. It is a bit like the body has become bored of the insulin, a little annoyed with it pestering all the time, and as a result when it hears its message, it won't respond with as much action. That becomes a problem because your blood sugar is going to remain too high if our blood sugar isn't put away into our cells. So, what happens to solve the problem is our bodies will produce even more insulin. Now, this can be very harmful to the body. First of all, having chronically high blood sugar can cause serious damage to our organs. For example, it is quite common for untreated diabetes to cause blindness, as the eyes become damaged. Second of all, the pressure on the pancreas to produce so much insulin can damage it. After diagnosis, people think, oh okay, I'm a diabetic now. They don't understand how severe the consequences can be, or they don't appreciate how much diabetes and maintenance drugs take away their freedoms. Real freedom comes from properly treating it with a long-term perspective, and there are so many things you can do to help. So, how do we help? Well, we know the problem lies in our blood sugar being too high, as well as our insulin responsivity being impaired. So, what causes those? Let's start with diet. It is the most well-known lifestyle factor, but even now, still some don't understand it fully. Generally, a diet high in fat and sugar will result in our blood sugar being too high. This might mean you regularly eat foods high in sugar or fat, like processed cakes. But, it could also mean you regularly eat foods which are high in sugar, without many people knowing it, like white rice. But it also goes much deeper than that. When we eat food, it gets digested before becoming the sugar in our blood. If it is digested quickly, it will spike our blood sugar very quickly. If it is digested slowly, it can have a more manageable effect on our blood sugar levels, and is much healthier. This is why if we drink it often, fruit juice, for example, is not healthy for us. It is because there is no fiber in the juice, and it is digested very quickly into the bloodstream. However, many whole fruits are usually full of fiber, so they are much healthier. If you have a diet high in sugar or fat, simply adding fiber into your diet can be very helpful in preventing your diabetic risk. Few people are also aware of how important timing is in our diets. You will remember from earlier that diabetes is not just about blood sugar, but also about how responsive our body is to insulin. If we were to eat food every 30 minutes of the day, we would never give our body a rest. Like we mentioned earlier, your body will get tired of the insulin messaging all the time, and stop responding to it. A healthy diet is one where you have defined meal times, with breaks in between. It can also help to eat at the same time each day, as your body can settle into a routine and get used to a healthy and regular insulin communication. The same goes for the time of day you eat. We can train our body into healthy insulin communication by eating breakfast in the first hour after we wake, and trying not to eat anything in the few hours before we sleep. It is almost as if, when we ensure our body has breaks, our internal body is able to communicate better, and can feel more. We feel hunger, we feel full, we feel our high blood sugar, rather than thinking it is normal. The goal is not necessarily to change our diet to one particular list of items, but it is to change our whole life and diet, so that we have more of a capacity to feel. And we see a similar pattern with other lifestyle behaviors, not just diet. Sleep problems, for example, can often too be underlying diabetes. Sleep is a very important part of rest for us, and insufficient or disrupted sleep, or sleeping during unusual hours, will mess with our hormones and healthy internal communication. Though, whilst it is important we get rest, on the flip side, positively engaging with life can help. First of all, engaging our body with movement. Sedentary behavior, or sitting around a lot, has been linked to diabetes. The same goes for a lack of exercise. It's not about doing a set amount of exercise, or any particular type of it. It's just about getting your body moving and feeling. As you do this, your body will learn to internally communicate better. For example, exercise really helps to increase our sensitivity to our hunger hormones. And engaging in life in general too. A recent study has found that your level of enjoyment of life has an effect on your risk of diabetes. It would be an unusual factor for a doctor to tell you about, but nonetheless is a really important factor. Another poorly understood player in diabetes is stress. Attention to stress has been growing recently, and now in the UK, some diabetic patients are referred to psychologists to help with stress management. So, why is it so important? Well, when our bodies are stressed, they are expecting to have to use a lot energy to tackle whatever they are stressed about. Consequently, stress will result in our cells releasing sugar into our blood, and our blood sugar will spike. A chronically stressed person could therefore develop a problem with diabetes through this pathway. It's really important to look after your stress levels and fully analyze where in your life you might be suffering from stress. It's also important to understand that having diabetes itself might be stressful, especially if you don't have the right support around you. The best solution to diabetes is one that understands your whole life, including your community, your emotions, and your happiness.